as with most oncologists now, an increasing percentage of our patients are elderly, and there is always a gap within clinical trials for assessing how our treatments work and the impact that they may have in patients who are more elderly, for example, and patients who are frail. Now, there's so many different scoring systems that we use, I guess, to varying degrees. But what I really find useful in my day-to-day practice is using the ONCOassist app to assess frailty. Now, why I like it is it takes all of the more standard tools that are recommended by the International Society of Geriatric Oncology, by ASCO, by NCCN, for example. It allows me to pick and choose which ones I need at any given moment in clinic. Now, I use these tools quite routinely. In my practice, I use them to assess patients before they starting treatment. I use them at different time points during their treatment. Now, as someone who works a lot with breast cancer patients and prostate cancer patients, for example, our endocrine therapies in patients who have quite long periods of survivorship is of particular interest to me. And there is certainly a gap in our understanding of how patients who are at high risk of frailty can then navigate their way through handling treatments that we give across the board. So when I see a patient like this in clinic, I would often go to my ONCOassist app and I would pull up the frailty scores. And of all of them, I do like to start generally with the geriatric assessment G8 tool. I think that's a very nice screen, and I do like the simple layout of the app. It is very straightforward for me to assess patients with it. It takes hardly any time, which is even more critical now as we're seeing more and more patients with the same amount of time. Once that's done, obviously can incorporate that with our traditional ECOG performance score, which is also part of the app. And then you can go a bit more into it based on what the G8 tool might show. So, for example, the CARG score, which is quite good for patients on chemotherapy in predicting their toxicity. The Charleston Comorbidity Index, because obviously with an increased aging population, we're also going to see an increasingly comorbid population as well. I do like the FRAIL scale as well, which is a very simple 5-item questionnaire. What I found most relevant beyond these screening tools, for my patients with prostate cancer, for example, where you're depriving them of testosterone with androgen deprivation therapy, I really like looking at their sarcopenic risk and the impact on their cognitive abilities. So for that, I like the SARC-F assessment, a really nice screening test for sarcopenia, and the Mini-Cog. Before ONCOassist developed this into their app, this would take me a lot of time in clinic, having to go onto different sites and different pages and just finding the different scoring tools, compiling the data, and then summarizing it into clinic. The biggest value of this app for most of us in practice is that it just collates everything into one very simple format. It is very straightforward for us to use this in clinic. It takes maybe about 5-10 minutes to do a thorough geriatric and frailty assessment for our patients. And it adds so much value to our documentation and so much more to our patient care. And it allows us the ability to assess prospectively how our treatments actually impact our patients on a day-to-day basis. So for me, this has been a real game changer. And I think the app is extremely useful. I would highly recommend it to anyone who works with geriatric oncology patients and any patients at risk of frailty. So yeah, I couldn't recommend it enough.